24 hours ago. I'm doing good.
Got some rest?
Good.
For those joining us, we are awaiting an announcement from Multnomah County regarding the opening of 13 new sobering and withdrawal management stations. We're going to find out a lot more info here in just a few. They're about ready to begin. We're expected to hear from several officials, including Chair Jessica Vega Peterson. So again, we'll find out more here momentarily, but we're going to hold on to this here to this shot with you and watch this live with you.
All right, good afternoon, everyone. Thank you for joining us. I'm Ryan Yarbrough. I'm with the Multnomah County Communications Office. We're here today to talk about the expansion of sobering stations at the Coordinated Care Pathway Center. I'm joined by Chair Jessica Vega Peterson, Commissioner Julia Brim Edwards, Dr. Ophelia Dapagima, the Director of Medical Services with Turk House, and Dorothy Elmore, the Director of Workplace Security with Multnomah County. And I will turn it over to the chair.
Hey, thank you, Ryan. Good afternoon. Thanks, everyone, for being here today. I'm Multnomah County Chair Jessica Vega Peterson, and I am so excited that we are all here today to announce the opening of 24-hour sobering services at the Coordinated Care Pathway Center. Today is the day I've been looking forward to for a very long time. For this community, our gap in crisis services started in 2019 with the closure of longtime sobering facility at Hooper Detox. I'm thrilled to announce that we are filling the gap next week with the opening of 13 sobering beds to join the deflection services already provided here at the Coordinated Care Pathway Center. When I became chair in 2023, this was one of our most pressing needs and one of the most difficult pain points for law enforcement and first responders. We knew that we needed to find a stable and sustainable way to provide alternatives to hospital emergency departments, jails, and intoxication happening every day on our streets. Helping people in crisis with these supports has been a priority for so many people. Myself, our Board of County Commissioners, and everyone who joins in today's announcement. I am grateful for the deep partnership that has gotten here. I am also so proud of the incredible work of Multnomah County staff who delivered both on a deflection program and this center in such a short amount of time. They were able to both set up the deflection center, a deflection program, and bring back the desperately needed sobering services for Multnomah County. I really appreciate everyone who believed in this vision, who knew that we could do multiple things at once. I want to say a special thanks to our law enforcement partners, our partners in other jurisdictions, and the DA, our provider community, all who have been a huge part of making this effort possible. We know that this 24-hour resource fills a critical gap that is going to benefit those law enforcement partners, our first responders, and our entire broader community. It is such an important addition to our larger continuum of care. The addition of sobering services to the deflection services we've had up and running since October continues our work to reduce the number of overdoses in Multnomah County while improving our overall community health and well-being. Most importantly, these 13 sobering beds expand our capacity to provide a safe and stable place for people to go who need care and respite on their path to recovery. Our system for treating people with substance use disorders must have multiple points of entry to meet community members where they're at, no matter what the time of day or night, and the ability for this facility to meet a need that's existed since 2019 will make a meaningful difference in the lives of people living with addiction. A public health approach to substance use disorder treats it as the complex chronic health condition that it is. While this is part of a complex system of programs and supports, at the heart, this work is about the people. Sobering is about meeting people where they are and providing respite, safety, connection, and stability. So I'm so proud and so grateful that this important work starts here next week. I want to invite up Commissioner Brim Edwards, who has been a leader and champion in this process every step of the way in building towards sobering services back in Multnomah County. I want to thank her so much for her leadership and invite her to share some words. Thank you.
Just kick it to the side.
Great. Thank you.
Well, good afternoon. Thank you, Chair. I'm Julia Brim Edwards, and I'm a Multnomah County Commissioner from District 3 from East Portland. It's exciting that we once again have these essential services in Multnomah County. It's been a journey to get here. We are bringing 13 essential sobering beds online now, and at the same time are pushing ahead boldly and as quickly as we can with building the permanent 24/7 Sobering Stabilization Center. Since my first day in office, and actually even before, I heard from first responders and the community about the urgent need to replace the capacity that had been lost in 2019 with the closure of the Sobering Center, and that we needed options for people who are intoxicated on our streets and in our neighborhoods, whether they be intoxicated from alcohol or drugs. The options that existed for first responders have been really limited, and they said they wanted something better because the options that were available to them were the emergency room, jail, or just leaving people on the street. None of those good options. So sobering provides an essential alternative to this current challenge and a place for people to connect with services, peers, and also a path to recovery. Early in my term of office, I visited sobering centers across the country, including the Church House in Baltimore, where I saw how they could both enhance public safety and provide a safe place for individuals to sober up and in many cases find a path to withdrawal and treatment. In the fall of 2023, I requested and the Board of County Commissioners approved funding to develop a permanent 24/7 drop-off crisis and sobering center. We then formed a sobering core project group, and this is, again, as the chair mentioned, this has all been all about partnership. It included public health experts, our public safety partners, the sheriff's office, law enforcement from Gresham, from Portland, and through that work we created a sobering center plan. And on top of that, our partners in the state legislature provided us with a really big assist by providing us with $25 million in funding towards the project, which is both contributed to this center and also to our future permanent center. As we opened this center last year, I continued pushing forward with the chair and the commission to open the permanent center, knowing that that was something that this community needs, both for its public safety, but also for the individuals who are suffering in crisis on our streets. We now have a site located in inner southeast Portland, and last week the county commission unanimously advanced the permanent center's project design plan. As we continue developing plans for the permanent site, the addition of these 13 temporary sobering beds here will provide a critical bridge until the permanent center is open. Earlier this week, I joined the sobering leadership team in touring the center and seeing the sobering beds that have been set up, and I just want to express my gratitude both to the staff here who will be working here and supporting people who come here, but also I want to just express gratitude to the county staff teams who have continued to push forward to stand up these critically needed beds. Huge thank you to Dorothy Elmore, excuse me, and her team for continuing to keep people, staff, clients, and the neighbors safe at the Pathway Center. So today marks really an important step forward to meaningfully address the crisis unfolding in our community and throughout the county and in our neighborhoods, and also to fill a very important need. We're going to be offering a safe and supportive environment so that we can help individuals begin their journey to recovery, at the same time improving community safety, which we all want, and reducing the burden on our emergency medical system and justice system. And with that, I'd like to welcome our partner from Turk.
Hello, everyone. Good afternoon once again. Welcome to the Coordinated Pathway Care Center. My name is Dr. Fletima. I am the Director of Medical Services for Turk House. I bring you all greetings from our CEO, Mr. Bernard J.B. Foster, and the entire leadership of Turk House. I'd like to welcome you all again as we mark the opening of the county's new Sobering program. Since our team began working with the Multnomah County last year, it has been our vision to build a multifaceted program that provides multiple ways for people to enter substance use treatment. Building and launching the Deflection Center was the first step of this journey, and now we are excited to begin phase 2 by opening the Sobering services. Our mission at the Sobering Center is to provide a safe and welcoming environment for individuals who are under the influence of drugs or alcohol to rest and begin to heal, as well as compassionate support and expert assistance to continue their recovery journeys. For now, all patients seen at the center will be seen and brought in only by law enforcement. Just like in Deflection, every patient who was brought to the Sobering Center will be greeted by a peer recovery specialist. Their belongings will be securely locked up as they meet with the intake specialist. They will then see a nurse to receive a medical assessment and a case manager who will collect information about their background and current situation. As part of their medical assessment, each patient will receive a urine drug screen, which will confirm reported substances used. We will monitor the patient as they comfortably sober. We will administer comfort medications as needed to help their withdrawal symptoms, as we will not provide substance use treatment at the Sobering Center. Unlike Deflection, patients receiving Sobering services will be allowed to stay at the center for up to 24 hours. We will also use this time to get to know each patient very well and help them make informed decisions about the best next steps for their treatment. While they are with us, each sobering patient will change into scrubs and be offered laundry services. Now that means that they will leave here with clean clothes while they leave our center. During their stay, patients will be offered a recliner where they can rest comfortably and sleep comfortably. We believe in patient-centered approach to addiction recovery, which means all decisions will be made collaboratively with the patient. And while our team will make recommendations, the patient will have autonomy to decide where they want to go next in their treatment. Once the decision is made, our team will ensure each patient is transferred safely to the next level of care, which may include withdrawal management, a detox program, outpatient services, or any other treatment programs as desired. The Turk House team will also follow up with each patient after they leave the center, so we can stay engaged and continue to support each person in their recovery journey. In preparation for this opening, we have significantly grown our team, which now includes a director of site services, medical director, nurses, case managers, peer recovery coaches and specialists, and intake specialists. We are now adequately staffed and prepared to provide both deflection and sobering services to the community 24 hours a day. Opening this Sobering Center is an exciting and significant step to our team. As Turk House has been treating people with substance use for more than 50 years, our vision is to provide help and hope for enduring recovery. When we first came to Portland, it was evident that the community needed more resources to help people get away from this deadly disease. Deflection was an important first step to give people who are arrested for possessing illegal substances an option to avoid jail and seek treatment. Now, with the 24/7 sobering services, we can provide immediate entry to treatment. Deflection was an important first step to give people who are arrested that entry. Our Turk House team, our philosophy is that it doesn't matter who you are, what your journey is, where you come from. Every time you come to us, we welcome you with open doors to recovery and treat you with empathy. Now, with this new Sobering Center, we are better prepared to help more people in the community get out of this debilitating disease of substance use. Thank you all.
Good afternoon. My name is Dorothy Elmore. I am the Director of Workplace Security at Multnomah County. Our number one priority is to provide a well-rounded, safe, secure environment for patients and the staff. Here at the Pathway Center, we have a presence of unarmed, uniformed security officers that provide 24/7 security coverage. Security officers continuously patrol inside and outside the center to ensure the safety of our staff, our patients, and our neighboring community. I'm happy to share that since the center opened in October 2024, we have seen no increase in criminal activity. Safety and security depend on everyone doing their part. So we want to acknowledge the staff, the officers, partnering law enforcement, and the community members for their work. The introduction of these 13 sobering stations marks an important step in Multnomah County's commitment to providing comprehensive care and support for individuals experiencing acute intoxication. As we introduce these sobering stations to the Pathway Center, we are working to ensure we are equally prepared to manage the increase in activity in and around the center. In preparation for the opening, we have been training our officers in this new space. We have been developing updated policies, procedures, and adjusting our protocols accordingly. This expansion will allow us to offer a safe and monitored environment for individuals to achieve recovery, reducing the strain on emergency services and providing a crucial point of entry into their continuum of care. With this new expansion, we remain committed to the safety of our staff and the individuals in our care. We are grateful for the ongoing partnerships that make this work possible, and we remain dedicated to working together to ensure the safety and well-being of everyone in our care. We believe that our security measures are in place to support this goal. And now I'll turn it back over to Ryan. Thank you.
Thank you, Dorothy. All right, we have time for questions. Please state your name, your outlet, and who your question is directed to. Because we have people listening online, I'll be restating the question as well. Christina.
Yeah, Christina with KPTV News. This question really is for anyone. Could somebody please break down the differences in the type of client that's using these services versus the type of client that's using deflection right now? What are the differences in those two systems? And then how is this different from the Sobering Center? I know we've said all these things, but can we get it all back on the record again?
The question is about the differences between sobering and deflection and the similarities as well, and the chair will answer.
Okay, they took away my step stool, so thanks for the question. And so I think the important thing to remember is that the Deflection Center and the deflection program was really a response to the House Bill 4002 that was passed in the last short legislative session that recriminalized a personal amount of drugs. And so we, just like almost all the counties across the state, created a program in partnership with county leaders, both our health department, our Department of Community Justice that does parole and probation, law enforcement, the courts, public defenders, providers, the city of Portland, law enforcement in many jurisdictions, including Gresham, to have to figure out that program that would work so that we could truly have a alternative path to jail for people who had that personal amount of drugs. And so we set up the program, we created the center, knowing that at the same time there was a critical need in our community to reestablish sobering services. And so sobering is going to be available for a wider part of the community than just those that have a drug enforcement misdemeanor that might be eligible for deflection. So this will be really based on law enforcement and eventually first responders who would be bringing people who they come across who don't necessarily even are going to have a charge, but who want to and need a safe, stable place to sober, to have respite, to have some of the services that we are going to be providing here. So it is going to be really bringing back, so this location is going to be doing both of those things, the deflection for those people who still have that drug enforcement misdemeanor, as well as the more broader sobering services. Now, we've had conversations, and there very likely will be folks who may be coming in for deflection who are going to come over and take advantage of the sobering services, but that's not necessarily the case. And again, sobering is going to be for a wider part of the population. This, though, I want to stress, this is our temporary facility. So we are actively working on the permanent facility that is going to be just a few blocks away on Grand Avenue, a little further south from here. That's going to be the permanent facility. In addition to being the permanent site for deflection, the permanent site for sobering, there's also going to be withdrawal management services at that permanent location. So it's actually going to be expanding the continuum of care and services that will be offered in one location. It's going to add very needed capacity around withdrawal management or detox, as well as expand our capacity for sobering too.
Can you talk about what services are provided here at these 13 beds, and then what are the situations in which a police officer would take somebody who's just drunk and bring them here, or something like that, intoxicated in some way?
Yeah, I'm going to turn the medical question over to our doctor.
Thank you so much. So once again, like she explained, the hope is to encourage the clients that come in for deflection to go into sobering. Now, again, sobering is for 24 hours. Okay, and so that gives us more time to get to know the patient and to connect them to treatments out there. That's the biggest piece that we didn't have in deflection. Now, the additional services in sobering is that now we have a medical director on board, and so with that happening on board, we're going to do urines. We didn't do urines for deflection, so the urines will tell exactly what's in their system. We'll go through a medical assessment, and that will help us connect them to the next level of care. So I hope I answered your question. So we didn't do urines in deflection. We're going to do urines in sobering, which kind of gives a little bit more about what's going on with the client or the patient, or what they're referred to as. And then they stay here for 24 hours. If they come in with alcohol, they can sleep it off. We'll give them time to sleep it off. And then when they wake up, we'll go through that assessment. Because we want a very detailed assessment, we don't want to rush them through anything, because with deflection, it was kind of like in and out. But with sobering, they can stay for up to 24 hours, and then we'll refer them out.
Are you giving them any medication to stabilize or anything like that?
Yeah, so we do give them comfort medications. Now, I don't want that to be confused with withdrawal management medications. We're not treating their substance. However, when they start withdrawing, they do have things like nausea, headaches. Now, we're going to provide all those medications, but we're not going to start them any Suboxone or any Brim or phenol that's going to treat the actual substance, but we'll make sure we give them comfort meds, that's what we call it, to keep them stabilized. If there's any diarrhea on board, any headaches, any common symptom that you get when you're beginning to withdraw, we'll give them those medications, and then we'll refer them out. So yeah, there will be those comfort medications to be given.
How do you measure success, and then also how do you make sure that they don't come back here 24 hours, 36 hours later?
That question is, how do we measure success, and if they don't come back within 24 hours? So once again, we do follow up with them. So once they leave here, our case management team will follow up with the client to see where they are. If there's everybody that they need to come back, our doors are always open. We've seen that in the past, and so we do engage with them even when they're not here any longer. We do have that consent where they sign an ROI, release of information, and we do call wherever we send them to follow up with them. Also, if they have a phone number, we call them to check up on them. So hopefully we can measure success that way. I hope I answered your question. Thank you.
Something to add, just to add on a measure of success, and this is more in the community safety aspect, but a measure of success once we're offering sobering services is that those individuals will no longer be taken to the emergency room or to the jail or left on the street, and we can actively measure that. Many of the sobering centers around the country, that's a key metric, is that people aren't ending up in the emergency room, because that's not the place that they should go. So a metric will be, are we diverting people from places where they shouldn't be or can't be best served, and are we actually able to serve them here? And that's more of a community metric versus the individual metric, but I think a really important one that our community expects and needs. And certainly if you're talking to people in the ER, they are looking forward to this opening as well, because they know that people who end up in the ER actually would be better served at their places like the sobering center.
So under what circumstances would a police officer bring someone here other than deflection? So now that you have these 13 beds and police officers can bring people
like if somebody
without possession.
is intoxicated on the street, just like before in 2019, if somebody is drunk, intoxicated with alcohol or drugs, and often people come voluntarily. Also sometimes in other places where if they're not from Portland, they don't have a home to go to, and they have an encounter with a first responder or law enforcement. Law enforcement will bring them here to sober them up.
So it's kind of like you're publicly intoxicated, they can charge you for public intoxication, but I'll bring you here instead if you don't want to go to jail. Is that sort of the scenario?
Well, or that let's get you safely off the street. Being intoxicated on the street is not a very safe place for people. So our experience, again, talking to people from around the country who run sobering centers, most people come voluntarily because it is a safe place where they can either sleep it off, get some food, get some services, and also get connected to peers and sort of get on their next step. So it's often offered as this would be a good place for you to go, and people accept it.
I want to reiterate, and it's just more so a better understanding. These 13 beds are the first time that you guys, the county's had sobering since that center closed in 2019. Did I hear that right?
And that was primarily a city-run service. But when it closed in 2019, then there was a gap in the community. So this project has very much been a collaborative project between the city and the county. So law enforcement, Portland Street Response, Fire Bureau, lots of first responders, providers have said like the county's taking the lead, but very much in partnership.
Why did it take so long to fill this need? It's been 5 years.
I don't know if anybody else wants to answer it. I got on the commission 2 years ago. This is the very first thing I raised. And we were coming out of the pandemic, and there had been an effort earlier to restand up a site. And I will just say the fact that when I raised the issue, the rest of the county commission and the city all said, yes, let's get to work on this. And so I think coming out of the pandemic, it was a natural place to reopen it, and it's a complex thing to do, which is why I'm really excited that we're able to stand up these temporary beds while we're in the process of building the permanent center.
Just to reiterate, I had a quick question, sorry. To reiterate, the release mentioned that these sobering stations are going to be prioritized for folks who are a part of the deflection, like the doctor said, moving from deflection to sobering. My question though is, it sounds like there might be other circumstances where law enforcement will bring these folks. Can you clarify? It's just a little unclear based from the release to now.
The sobering beds will be open to, if there are stations open, will be open to people who need sobering who aren't engaged in deflection.
Okay.
I mean, obviously deflection is just for drugs, not for alcohol. So, hopefully these will be utilized, be well utilized. We know there's huge demand, so deflection may be one piece, but also law enforcement and first responders being able to bring a host of other people who need sobering, which if you're out in our neighborhoods and our streets, there are a lot of people who can utilize the service.
Thank you.
Thanks. And I will just, I'll just add to that. I mean, law enforcement are also the folks who are bringing people to the deflection center. So this is really giving a continuation of services and extending the opportunity, I think, for people to stabilize and then get connected to those services when they might be in a more receptive condition to do that. But this is going to be a really important resource for law enforcement, for folks who don't necessarily have that charge or a charge, but are going to be brought here voluntarily. Excuse me. And I think that just like with the deflection center, there was a learning of what is the demand going to be like, what is what are the what it's going to look like in terms of the capacity or the need for folks. That's really we're really looking forward to learning a lot from this being opened up in the first month. So the first month, we really want to make sure that these beds are available for law enforcement bringing in, and then we'll look at adding the ability for first responders to also be bringing people here. So we are really going to be paying attention to the use of it, the demand for it, and how things are going. We want this to be successful. We know that this is something that the community needs to just reflect a little bit back on the length of time that it took to do this. One of the reasons why sobering closed in 2019 was that we weren't just talking about a population that was intoxicated because of alcohol, but because of all the other drugs that were in the that people were seeing, and the additional medical needs that were. So I think it's very appropriate that the county is now hosting this and developing these, because our health department has done a great job of really recognizing what the need is, working with Turkhouse to design a program that reflects that, and having the expanded capacity. So this is a really important service that we are providing now with the right wraparounds, I would say, for people for what the intoxication looks like. And there's going to be a lot of learnings as we continue to grow those services and programs in our permanent facility by adding those withdrawal management services as well.
Joelle and then Christina.
Excellent. Thank you so much. Just one more question for the doctor. Is this what it will look like when these stations open up come Monday, where there'll be curtains? I'm just wondering if it's going to be out and open like this.
Just like this, what you see. Now, the reason that we didn't do current, you want to see what's going on with the client. So where everybody else is at the nurse's station, and so you want visibility. You want to see how the client is doing. With the recliners go all the way back. They can lay down, they can rest. You don't. It's not an urgent care, or privacy is there. However, you want to see what the client is doing. You want to see how they're doing, how they're withdrawing, and everything. So the nurses have visibility to every client. Hence why the layout is the way it is. So no, there will not be curtains, but that's why we have the steps, so that each client has some kind of privacy in their own space, but not from the staff, because we want the staff to be able to see and monitor them at all times.
Yeah, this is a question for the chair. I'm wondering where you're at with the Good Neighborhood Agreement and how this changes things potentially. I mean, 24 hours, obviously this was always in the plan, but I imagine that might complicate things since these discussions are ongoing.
The question is where we're at with the Good Neighborhood Agreement.
Yeah, thank you. So, conversation is proceeding with the Good Neighbor Agreement. I mean, and we're working for that. We're working towards that Good Neighbor Agreement for this facility. We are also starting the outreach and the community engagement for the permanent facility too. We did, this going to 24 hours, changes. I think the hours of use, but it also doesn't change anything with like the security that we are going to be providing, our role as being a good neighbor and making sure that we are, we have the security who is going to be doing the walkarounds, that we are, reporting things as ourselves as the neighbor who wants to have a safe environment for our clients. So all of that is, so there was a part of the plan for going towards 24-hour services and expanding services here was also about community engagement and making sure that there were conversations with community on that.
So where are you at with the agreement? Is it close to being reached?
I think it's still, and we are still working on it. I think we're, and I actually don't know, and I'm looking to see if there's anyone. There are ongoing meetings. I think there's about like monthly meetings that are happening with neighborhoods on a regular basis. So those conversations are continuing to work through this. I mean, I will say that, we want, what the most important thing for me is to make sure that we have good, solid relationships with our neighbors here, and that we have two-way communication on what's happening. So those monthly meetings are a way to do that, making sure that if there is an issue or if there's a concern, that people know who to call, and I think that we have very much established those things. We don't necessarily have formal good neighbor agreements with every single county facility, even though we have really good, healthy relationships. For instance, the BHRC, right? There isn't a formal good neighbor agreement there, but there are regular meetings, communications about what's happening there. And so again, it would be great if we get to that, and the goal is to work towards that. But for me, it's making sure that we have positive relationships and communication.
All right. If there are no further questions, one last question. Yeah.
Can you talk a little bit about the budget for all of these projects? This particular project was increased, double the budget. Now the other sobering center is also being increased in budget. This is during a very difficult budget time for the county. Why is this costing so much? Some people say it's because you're cutting corners and planning. Is that true?
Questions about the budget, and we'll hand it off to Commissioner.
We could maybe do a tag team. I'll say in the original sobering center plan that we put together, which was somewhat the platform for our request to the legislature for $25 million, it did not include withdrawal management. And so we really will have an enhanced set of services. So in the permanent center, you will have approximately half, we don't know the exact division, but half sobering beds. and then the other portion of the building will be withdrawal management. So literally you can go from, and this is somewhat how Turk House is set up in Baltimore, where you can come in for sobering, sober up, you can stabilize, and then if you decide you want to go to withdrawal management, you literally can just walk across, in this case, the block, but in Portland it'll be in the same building. And on that side of the building, people can stay up to 7 days, I believe. And that is just a different building structure, so it's going to cost more because you actually aren't keeping people. Sobering is 24 hours, and the other side, going to withdrawal management, which will be the other half of the building, is people staying for 7 days and getting them stabilized and going through that withdrawal process. So it's a bigger project than when we initially launched it. So that's for that project. And I don't know if you want to speak to this particular building.
Yeah, I mean, I think both for, and thank you, Commissioner Brim Edwards. I think sometimes you don't know exactly what a project's going to look like until you get into the building and you see what really needs to happen. And I think that was the case in this building. It was, for many reasons, this was a great site. The access for law enforcement is to bring people the ability to build out 2 separate spaces as we were staging the work here. All of that was great, but there were things that needed to happen structurally that we really didn't find out until we got into the building. So I think that was a piece of this. We have a much longer timeline for the permanent facility in terms of our ability to plan out and work with our both the design team and the construction team, and they are already on board. So just last week, the board approved the FACT 1 to start that design process. So we're going to have all of that. I think what we saw and what came before the board last week in terms of the price and in terms of the timeline was really a result of, okay, now we know what building we're going to be working with, and these are the things that we know are going to need to happen with that building, both because of the building itself and, as Commissioner Brim Edwards said, because of the services that were going to be happening there.
It's also worth noting that these stations can go to the permanent center, so there'll be pieces of this that we'll be able to reuse, and that was purposely designed because we knew this was going to be temporary, and that eventually deflection, permanent sobering, and withdrawal management would all be in the same place. So hopefully there'll be some cost efficiencies there as well.
All right, that's all the time we have today for questions, but if you have any follow-up questions, please reach out to us at press office at